on the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Well, here is a startling statistic for anyone diagnosed with heart failure. Patients diagnosed with heart failure have a 50% chance of dying within 5 years. However, those numbers greatly improve if you receive the proper treatment. Joining us this morning to explain how Baptist Health can help you to keep on amazing, Dr. Patrick Campbell joining us with the Baptist Health Heart Failure and Transplant Institute, and someone that knows firsthand what it's like to live with heart failure, Courtney Osborne. Thank you guys for being here this morning. First, Dr. Campbell, I guess explain to us and our viewers out there a little bit, what is heart failure defined as?
Well, thank you for having me here. Heart failure really is a clinical constellation of symptoms. It includes shortness of breath, swelling in the legs, nausea, fatigue, inability to exercise. And it really stems from an inability of the heart to pump blood efficiently, to supply enough blood to the vital organs in the body, and fluid backs up into the lungs and into the legs, causing the swelling and the shortness of breath.
Why is the mortality rate so high, 50%, if proper treatment isn't given?
Well, the mortality rate's so high because it is a progressive disease, and the heart affects every other organ in the body. If not treated and goes on, continues to progress unabated, it'll cause kidney failure and liver failure. People will be unable to breathe, and so it's the mortality comes from the fact that the heart affects every other part of the body.
What are some of the treatments to improve quality of life and really make sure that we beat that statistic?
Well, the mainstay of treatment is medication, and the medications include beta blockers and ACE inhibitors and aldosterone blockade. But really, more importantly, you have to also include lifestyle modifications, including exercise, sodium restriction, fluid restriction, and living a healthy lifestyle, and really cutting out things like smoking, eating fatty fried foods. So it's an entire picture of not just the medications, but a healthy lifestyle in general.
Courtney, how were you diagnosed with this? How did you know?
I was originally diagnosed after I had my son. I was having difficulty breathing. I had swelling in my legs, which I originally at first thought it was just after having a child.
Sure.
But after a couple of weeks, we found out it was because of the heart failure.
Really? Okay,
Yes.
So it didn't happen at all before pregnancy?
No, I had a very good pregnancy,
Yeah.
and if I could do it again, I would.
Yeah.
But after the pregnancy, I guess my son wasn't even 2 weeks old yet, and I was actually laying down with him, and I was hearing this wheezing sound, and I thought it was him, and it scared me, and so I kind of held my breath, and I realized the wheezing had stopped, and it was me.
Really?
I was the one who was wheezing, and I just thought it was a respiratory infection or something. We just had our first snow, and I just didn't think much of it.
Yeah.
So I called my gynecologist, and he got me in, and when I went in, my heart rate was like 150 something, and he immediately sent me to the ER.
Really?
Yes.
Okay, so from that moment, since you've been treated at Baptist Health, kind of walk us through what all has been happening and how they've helped you out.
If it wasn't for them, I wouldn't be alive. But I originally spent 1 week in the hospital, then I was out for 3 weeks, and then I ended up back in the hospital, and I was in the CVICU for 2 weeks, where Dr. Campbell took care of me, and then after the 2 weeks in CVICU, I made it up to the heart floor and was there for another 2 weeks. And, it was a long road, and I spent almost a month in the hospital away from my son. And
Who's a newborn?
Yes,
Yeah.
and the hospital is just not the best place for a baby,
Sure,
especially not the CVICU.
Yeah.
So I missed a lot of time with him, and it was hard. But in the end, I knew what the best thing was to do was for me to stay there and get healthy.
And now you feel?
I feel amazing.
Yeah?
Yes.
That's the perfect phrase for it, I think.
I went from low to now I'm great.
Dr. Campbell, interesting there that the signs and symptoms didn't show up till after pregnancy. Is there any way that maybe, what did that have to do with it, or why did that happen?
Well, it's actually, what Courtney had is peripartum cardiomyopathy, and it's a relatively rare condition that occurs in the last 1 month to up to 5 months after delivery.
Okay.
And it's related to hormonal shifts. We're not 100% sure. The science still doesn't tell us exactly why it happens, but that's what she describes is what many people describe as well. They think it's something unrelated to their heart. It's a viral infection or
the
just
weather.
The weather.
Yeah.
And so the symptoms can often be very, very subtle, and people miss them for a long period of time before they seek out treatment for them.
Okay, so if those watching at home, if you are going through any of the symptoms that Courtney mentioned, or if you know someone that is and they just think there's nothing to it, contact your doctor, and of course contact you guys over there, or if you're referred, you can obviously go over
Absolutely.
there and see you guys at the Baptist Health line is the number on your screen. But really, it's something that you do not want to wait, folks, because as we mentioned, between 1 and 5 years, Doc, is what they say if it goes undiagnosed.
Yeah, once diagnosed within 5 years, 50% of people with heart failure will die.
Unless they're properly treated and taken care of, and that's what they do over there at Baptist Health. So make sure you give them a call today. Thank you so much for coming in, sharing your story, and hopefully inspiring others out there to go get checked and make sure that you are taking care of yourself and doing the right things to avoid being a part of that statistic.